Epidemic that affects more than 6 million people in the U.S., and doctors diagnose 800,000 new cases each year.
Heart failure is actually the number one cause for admission in the Medicare population.
Even with medication, those with heart failure have a poor prognosis. They're highly symptomatic, with a huge majority experiencing shortness of breath, says Dr. David Barron with Sentara Heart Hospital.
These are patients that sometimes we'll consider things like intravenous medications at home, or heart transplant, or surgical heart pumps. Typically, these are people who have at least been hospitalized once in the prior year, and ones where we don't have another answer.
But now they do. This device, called a V-Wave shunt, is no bigger than a dime. Sentara is participating in a clinical trial called Relieve HF, inserting a device to help patients with diastolic and systolic heart failure.
I go in via the leg myself. We go from the vein in the leg. All in all, it takes about a half an hour. We insert this, looks like a pair of funnels. So it prevents that pressure from building up by safely shunting it to the right side of the heart.
Previously, that pressure and difficulty breathing leads to more than 90% of heart failure hospitalizations.
Some patients who are a bit more fragile, where one of these invasive techniques would not be appropriate.
75 different heart hospitals across the U.S. are participating in the clinical research trial. However, Sentara is the only site here in the Commonwealth testing the V-Wave shunt.
For us now at Sentara to be able to offer something that only a few sites in the United States can give is really great.
A small, novel device could be the answer to a better quality of life.
A lot of patients we see have been told there's nothing they can do, and we have a lot of various options we can provide at the center.
In Norfolk, Chelsea Donovan, News 3.